What are the best fluids for kids with flu to prevent dehydration? When a child catches the flu, keeping them hydrated can be a real challenge, but it is also one of the most important steps to help them recover. Fever, vomiting, and decreased appetite can cause rapid fluid loss, so offering the right fluids is essential. The goal is to provide fluids that are easy to tolerate, help replace lost water and electrolytes, and prevent dehydration from worsening. Dehydration happens when the body loses more fluids than it takes in. In children with the flu, this can happen quickly because fever makes them sweat more, and symptoms like vomiting or diarrhea directly remove fluids and vital electrolytes like sodium and potassium. Even if a child isn't eating much, continuing to offer fluids is crucial to keep them hydrated and support their recovery. The best fluids for preventing dehydration are those that contain a proper balance of water, sugar, and salts. Oral rehydration solutions like Pedialyte or Influenza are specially formulated to help the body absorb fluids and electrolytes more effectively than plain water, especially when vomiting or diarrhea are present. For infants under 6 months, breast milk or formula remains the best choice. If a baby is vomiting repeatedly, it's important to consult a healthcare provider before switching to an oral rehydration solution. For older infants and children, oral rehydration solutions are still the preferred option. If these are not available, diluted apple juice, half water and half juice, can be used for children over 1 year old. It's important to avoid giving full-strength juices, sodas, or sports drinks because their high sugar content can worsen diarrhea and dehydration. Older children can also benefit from clear broths, gelatin snacks like Jell-O, or electrolyte ice pops. These can help maintain hydration but should not replace oral rehydration solutions if dehydration is a concern. The key is to offer small amounts of fluids frequently. Think teaspoons or sips every few minutes, rather than large gulps, which can trigger more vomiting. For young children, using a syringe, spoon, or small cup can help control how much they drink. The aim is for the child to take in at least 1 ounce or about 30 milliliters per hour, adjusting based on their size and how severe their symptoms are. If a child vomits, wait about 30 to 60 minutes before offering small amounts of fluid again. Do not force them to drink if they are sleeping comfortably or seem unwilling. Keep track of how much they are drinking, especially if vomiting or diarrhea continues. For infants, continue breastfeeding or formula feeding, and consider adding oral rehydration solutions if advised by your healthcare provider. For older children, offering a variety of fluids can encourage them to drink more, but prioritize oral rehydration solutions if dehydration is a concern. It's important to watch for signs of severe dehydration, such as no urination for several hours, a very dry mouth, sunken eyes, or extreme lethargy. If your child cannot keep any fluids down, shows signs of severe dehydration, or if you are worried at all, seek medical help promptly. In some cases, dehydration can become serious and requiring medical treatment, including intravenous fluids. In summary, the best fluids to prevent dehydration in children with the flu are oral rehydration solutions, breast milk or formula for infants, and diluted fruit juice for older children if needed. Offer small amounts often, monitor their hydration status, and don't hesitate to contact a healthcare professional if symptoms worsen or if you have concerns. Proper hydration is a key part of managing the flu in children and can help prevent complications. Always follow your healthcare provider's advice for your child's specific needs to ensure they stay safe and well during their illness.